Fellow countrymen, have you ever wondered what corruption is or how it looks? Well, probably you haven't. Moving out to the hospitals and seeing that there are no drugs because of somebody's irresponsibility, or probably getting an accident because our leaders have not allocated the funds to cater for our roads. In this very particular one, we'll be tackling what corruption is and how best can we address some of those challenges and how best can we have a future. A very good day to you. Welcome to the Virtual National Students Anti-Corruption Challenge 2023-2024. My name is Collins Engoru, a student at Soroti Secondary School, 17 years of age. Well, we'll be listening to the people across the country discussing about what could be Uganda's biggest problem and how best can we address that. In this very particular one, I'm joined by none other than the LC5 chairperson of Soroti District, that is Mr. Simon Peter Edoru Ekuu, who also doubles as the spokesperson of the LC5 body of Teso sub-region, a well-seasoned politician. You're welcome, sir.
Thank you very much.
Thank you. Well, sir, it's not a new thing to you when we talk about corruption in a country like Uganda, especially in your experience in the service sector and how you've catered to help the citizenry. Well, to begin with, we look at the health sector. We've seen situations whereby drugs are being stolen from hospitals. We're looking at things like ghost workers in hospitals, whereby there's a list of people working, but then are not even there. In a way that this has left indigenous communities desperate and cannot afford quality service delivery in terms of health. As a technocrat and as a leader, how best can we address transparency in the health sector?
First of all, I want to thank you so much for coming.
Okay.
Yeah, so first of all, I want to thank you so much. One important thing that you have come up with is to share with the leadership on what is said out there. Corruption is not a new vice, it's a common vice that has eaten not only health, it has eaten almost all sectors. Now when you come to health in particular, as you have interested yourself, the issue of drugs is not about the locals, it's about the technocrats in the health centers. You find that when drugs come, in most cases, these drugs are not all given to our age. Some drugs end up in private drug shops, in private clinics. And who does this? You find that the entire system has loopholes. It starts from the management of the health center, it goes to the support staff, and some technocrats in the health center. I want to give an example of quarantine. We find that the Uganda government quarantine is in all most of these drug shops. How does it reach there? It leaves the health center and comes out. But who is the main player in this corruption? Is the common man in the village. Because if you went to the clinic or a drug and you are given a Ugandan stamped drug, why do you pay? By the time you accept to pay, then you are part of the system. Because I expect people to come and begin drumming. Clinic X has these drugs. I bought this for you. Act as we will use you as not being as a whistleblower. You just come as a state witness because you already have the drug and you know where you bought them from. But because people have kept quiet, so you find that it becomes very difficult for leaders like me to see how best we can stop this vice. So, but this vice should start from all of us.
But also, some people have gone ahead to complain. The reason as why they feel it's difficult to come out is their security. So how do you guarantee that they'll be safe?
No, now when you look at the current the IGG and most of these government state machineries and all that do not reveal. There's a law clear that protects all the whistleblowers. So everybody is safe. It's just because people lack the information. So they believe if they went out and spoke about this, they can be arrested, they can be killed, but you are very safe. What we need to tell our people out there, let us fight this fight together. In health centers, it's true the supplies may not be good enough, but even if you have 50%, let it go to the 180. But if you supply the 30, then if 15 does not reach the common man, this becomes a very big challenge to government. So the whole thing is we must come up as a team and we fight this together.
Well, that's very insightful from you, sir. Now, moving on to look at the infrastructure. This is infrastructure, of course, governs our daily livelihood, and it is proven by Transparency International that its corruption is affecting the infrastructure, whereby we are looking at the quality of infrastructure delivered is very poor. Roads that are constructed have short lifespans. We have bridges that collapse, like Karuma, and of course we had the Ginger and the Nile Bridge as well. As a leader and as someone who is involved in policy making, what do you think is the main influencer when you look at corruption in the infrastructure sector?
First of all, people have narrowed corruption to particular, maybe to local governments, maybe to ministries. But corruption starts from factories.
Yes.
You find that the quality of cement you have is one thing. Even all the material that we use, the government has not also taken a very keen interest in getting to know the quality of cement, the quality of sand, the quality of the mabatis we use. All these things are wanted. So you find that people can do standard mixing of cement and sand and all that. But at the end of the day, you see cracks in the building. So meaning that this corruption, let us not limit it to where the project is implemented. Can we go down even to the materials being used? So corruption is eating not only the implementing entities, but it's the entire system.
But when you talk about quality, I think this is where now the Uganda National Bureau of Standards.
Exactly.
There is some aspect of loophole in this.
That's what I'm saying. When we talk about corruption, sometimes people focus on small areas, but the entire system needs to be checked. Now, then also when you come up to maybe to the procurement systems that we have, in Uganda we have what they call it what? There's a word they use, where procurement is done centrally.
Yes.
It is done centrally, but the project is a local project, but procured by the center. At the end of the day, the people that go through the system, the chain makes it very weak. Because first of all, people begin showing interest from the center up the person. By the time it reaches here, a lot of monies
has been divided.
Yes. So by the time we receive as local government, we are receiving 80%. The 20% you cannot understand. Now the contractor comes in to try to recover what he lost. So some of the systems that we're also using as government make life very hard for contractors. People are beginning to have demands. I hear when you do a contract, you must pay a certain percentage to the technical team that did the work. You must pay to the ministry that delivered. But these are things that people don't speak about. But for us who sit down here, these are the challenges we find. So when we talk about corruption in the entire infrastructure, it also gets down the one edge. We sometimes go and work on roads. The grader is parked, somebody goes and steals fuel from that grader. That also affects the contractor. So he has to recover the fuel that was stolen by one edge. You have cement, it is stolen in those village stores. So the whole system,
the local man has to be involved,
is part of the corruption. For me, when I look at the country now, there is nobody who is clean now. How you have failed to run your office, then it comes to the political leaders. As we pass these policies, do we have time to also go and check what we are talking about in Parliament, in these district councils? Do we move out to supervise? Do we monitor some of these things? Do we give information to the local person? Because sometimes a local person is given a project, maybe a borehole.
Yes.
He does not know, is this a solar powered borehole? Is this a manual borehole? Nobody goes to tell the local person. So by the time he receives a manual borehole, but the money was maybe for a solar borehole. So some of these things, so all of us are a problem. We must move the people must also accept what is told to them. Then also when we move out to other agencies of government that contribute to the main game,
yes,
must also play their roles very well.
Well, indeed. So it's important for the local man to be involved in this.
The most important person who can stop or reduce corruption is a local man.
Thank you so much. You've already heard it from the LC5 himself. One, he mentions to us that the health ministry, there's need for you as a citizen to step out and be part of this fight. Number 2, how best can we address infrastructural development in as far as transparency is concerned? Fellow countrymen, it's also important that you become part of this fight. The other thing that we need to be conscious about is the policies that we make. Even when policies are made, you have a right as a citizen to question your leaders in as far as accountability is concerned. Thank you so much, Mr. LC5, for your time. Thank you so much for the leadership, for the insight.
Thank you very much. Wish you well.
Thank you.
Okay, yeah.